Now we're going to talk about the contraindications to antipsychotic switching. I would emphasize here that there aren't any absolute contraindications to antipsychotic switching. However, there are several what I would call relative contraindications. That is, certain clinical scenarios where switching medications might be ill-advised or really should only be done with great caution. So one of those situations would be patients who have recently recovered from an episode of acute psychosis, and they're taking the antipsychotic to which they responded during the period of illness exacerbation. So a patient's hospitalized for acute psychosis, they were stabilized on risperidone, they've been discharged from the hospital, you're seeing them 1 week, 2 weeks, a month after hospital discharge, and they've recovered. That would be a time when a switch might be particularly ill-advised as they're recovering from that acute illness episode. A second relative contraindication would be patients who are currently stable on a long-acting injectable antipsychotic medication, and they have a history of poor adherence with oral agents that have resulted in illness exacerbation. And so we've got a patient who's not done well on oral agents and they're stable on an LAI, I think it makes a lot of sense to try to encourage the patient to continue with the long-acting injectable medication and address potential adverse effects, tolerability, other concerns prior to initiating a switch. We know that there's a broad literature suggesting a host of improved outcomes in terms of psychiatric stability and even issues related to morbidity and mortality for patients who are willing to accept long-acting injectable antipsychotic medications. And then a third relative contraindication would be patients who are currently stable on an antipsychotic and they have a history of significant violence to themselves or others, or just extremely severe symptoms during illness exacerbation. This scenario makes me think of patients who might particularly benefit from treatment with clozapine, which is known to improve outcomes related to suicide and violence. And so if we had a patient who's stable on such an antipsychotic, they have this history of suicidal, homicidal ideation and behavior, or just severe illness, and they're stable, we want to do everything we can to keep them on that particular medication. So the key points here, number one, there are no absolute contraindications to antipsychotic switching. However, switching may be ill-advised or should be done with great caution in certain clinical scenarios, such as patients who've recovered from an episode of acute psychosis, those who are stable on long-acting injectable medicines with a history of poor oral antipsychotic adherence, and stable patients with a history of significant violence or severe symptoms.